My name is Dr. Ravindra Mehta. I am the Chief of Pulmonology, Sleep Disorders Medicine and Intensive Care Medicine at Apollo Hospitals in Jayanagar, Bangalore. A brief background, I trained in Mumbai for my basic MBBS and MD, and after that went on to the US where I've done fellowships in pulmonology, sleep disorders and critical care medicine in addition to interventional pulmonology. And I'm American board certified for pulmonology, sleep disorders medicine, critical care medicine and intervention pulmonology. So sleep apnea is a common problem which is now increasing because of certain reasons which we'll get into. Briefly, sleep apnea means that the airway which is supposed to be open at night is now choking at night. Typically, it's a night phenomena. One is not to confuse that with a day phenomena. The word sleep means occurring at night and sleep, and apnea is a Greek word for cessation of breathing, which in simple terms mean that you stop breathing at night or you breathe much less at night, which has consequences which we'll be talking about on both your quality of life and very importantly on health issues, which is turning out to be more and more as we see the consequences of this disorder. Yeah, so sleep apnea in short, when you stop breathing at night, it's basically either because of a blockade, that means your airway is getting either narrowed or choked down, which is called obstructive sleep apnea. Then there's something called central sleep apnea, where the controller or driver of breathing in the brain slows down or stops. And so in such a situation, the trigger which you and I take for granted is now impaired, and that itself can lead to slowing of breathing, and that's called central sleep apnea. The third is obviously a mixture of the two. Most common is obstructive sleep apnea. After that, it's either central or mixed sleep apnea. Yeah, so obstructive sleep apnea, as we talked about, is because of choking of the airway. So you can take the analogy to a highway. When the highway is flowing freely with all three lanes open, traffic will go wonderfully. Similarly, if the airway is open, and by the airway we mean the entire path starting from your nose and your mouth going to the back of your throat and down to your windpipe. So that is a curved narrow area which nature has made that is supposed to be open in the day and slightly narrows at night because of muscle relaxation. As you know, all your other muscles relax in sleep at night. So even the muscles which are surrounding the airway relax. So in the daytime they're open, in the nighttime they relax. And when they relax, they tend to narrow down the airway. So the analogy we give is that a 3-lane highway can become a 2-lane highway, which is still okay at night. However, if they narrow down even further and either become critically narrow or shut down, that's when you stop breathing or breathe much less than you should. That's called obstructive, which means there is an obstruction. Sleep, because happens at night, and apnea, which is the Greek word for stopping breathing. The causes for that, by and large, the most common cause is weight gain. When you put on weight, fat also accumulates in the airway. So typically, like on a highway, you will have 2 lines of trucks which will narrow the highway. Similarly, over there, fat will line the airway and make it narrow to the extent that this happens. The other cause is your built. I mean, if the good Lord or nature made you in a way that your entire airway is narrowed, in short, the tongue is a little big, tonsils are large, the tissues in the back, the thing what you see called the uvula is large, and the palate is large, that tends to create a situation where the space gets narrowed. Pretty much like a Mumbai flat where everything is closeted inside. In such a situation, you don't breathe enough at night to stop breathing, and that leads to obstructive sleep apnea. So these are the commonest causes of this interesting entity. Right. So OSA, the first thing is what is, we've understood that now. How do I know more about it? Signs and symptoms are related to obstruction. So if we stop or slow down or stop the passage of air in the airway, the first thing one sees is snoring. Snoring, which is often very loud. So let's not confuse all snoring with sleep apnea. This message is not to say that all those of you who snore have sleep apnea. It is just that snoring is an accompaniment of sleep apnea, and most people with sleep apnea will have snoring. So snoring happens because of the passage of air through a narrow passage. Those of you who remember your physics, it's called Bernoulli's phenomena, where air is gushing through just like a train going through a tunnel, and in such a situation loud snoring happens. Usually very loud snoring is associated with sleep apnea. The other symptoms are related to again airway shutting down. We spoke of stopping breathing, and that's why some people either breathe less or stop breathing at night, which is often noticed by a bed partner. Often you will not notice that, but your bed partner will tell you that suddenly you stop breathing, I was very worried, and I nudged you because I thought you would suddenly not make it or die. So that's one of the common symptoms of sleep apnea. Because your sleep is disturbed at night because of all these things, you wake up feeling non-refreshed in the morning. So it's called non-refreshing or non-restorative sleep, another cardinal symptom. And you are tired in the daytime. And so your activities, you have less energy, you may doze off, you may sleep in a lecture, you may sleep in a meeting, you may sleep in the back of a car, and that's called excessive daytime somnolence or sleepiness. So these are the cardinal symptoms which usually help you to suspect sleep apnea. So risk factors, as we touched on. So as we understand the entity, we'll be get into why it happens. How do you obstruct an airway? Well, you need to narrow it down. How do you narrow it down? It's either you were born that way, that basically, like we said, large tonsils, a floppy uvula or the little thing hanging in the back, a floppy curtain of the mouth called a soft palate, a lot of tissue out there which should not have been there, a large tongue which obstructs it. These are the common things. Or a jaw structure which is in such a way that you have narrow space in the back. And this is commonly seen in the northeast part of our country where it can vary that way. So it's anatomical or nature given narrowing of the airway which leads to sleep apnea. More common is you put in fat over there. So fat accumulates there, it narrows the airway, and that is one of the most common causes of sleep apnea in modern times, where we have an epidemic of obesity. So with obesity is fat everywhere is fat in the throat or in the airway, which leads to sleep apnea. Right. So the main impact of sleep apnea, why do we talk about it? Not because it's an interesting entity, because it has certain repercussions on the human race. The repercussions or the impact is divided into two types. One is quality of life. Now imagine if you don't get sleep at night. No patient with sleep apnea gets proper sleep at night. So if we are sleep deprived, and all of you must have gone through it, what are the consequences? You're tired, you're sleepy, your memory goes down, your attention goes down, you're unable to function at a good level. It affects your interpersonal relationships, your productivity, your work, your attitude, everything. So it's a huge quality of life issue when you are sleep deprived night after night for months to years. And so quality of life is a major issue. Further repercussions of that are also related to chronic fatigue, sexual dysfunction. All of that is described with sleep apnea when it comes to quality of life. Health repercussions assumed a lot of importance, especially in India. It's always seen that people are worried about the health part of it and quality of life is a little secondary, but both are just as important in other parts of the world. So in terms of health repercussions, it's a major risk factor for high blood pressure. So a moderate to severe sleep apnea, which means intensity of a certain nature where it's impacting your breathing at night, can be a risk factor for high blood pressure. Consequent to high blood pressure is heart disease. It is also been known to associate with worsening diabetes. It may not directly be a cause of diabetes, or diabetes is not directly related to sleep apnea, but worsening diabetes. Very worrisome, severe sleep apnea is related to worsening of heart disease. If you have existing heart disease and every night you're breathing less and your body is not getting enough oxygen, it's going to worsen existing heart disease is a worry. It is associated with worsening of heart failure. People with heart failure have to look at this carefully as a correctable cause. And paramount, it's been associated with sudden death. There's been, you've heard of people who are very heavy and suddenly they passed away and they sleep in the morning at 4 a.m. It is often seen because of severe sleep apnea. So these are a few of the health ramifications. Many of them have been discovered. I leave you with one small understanding. If something impacts your sleep, sleep is 1/3 to 1/4 of your day-to-day life. So your entire life, 1/3 to 1/4 is sleep. So if that is inappropriate, inadequate or disturbed, obviously it will lead to impact on other parts, which is health, and that is why sleep apnea is related to major health issues as we discussed. Right, so once we think of OSA, it's all this clinical stuff. So as a lay person, I would think, okay, I'm heavy, I've noticed I'm tired, my wife complains I'm snoring a lot, I wake up feeling exhausted, I have to drag myself to work. While driving one day, I nearly fell asleep at a signal and I had an accident. All these are the symptoms of sleep apnea. When you suspect it, well, these are net times. People go on the net and boom, it shows up out there. If you put a constellation of symptoms, then you end up getting evaluated. Evaluation is a process which requires a clinical evaluation by a doctor, someone who's good at this stuff, and then often or most likely a sleep study is requested. These sleep studies are a detailed discussion. Bottom line, in modern times, we can also do them in the home setting for a good number of people. Once the study is done, the information comes in that this sleep apnea is there and it is classified into mild, moderate or severe. This is a detailed discussion, but suffice it is to say that once we classify it, the options are threefold. First option on general note plane is lose weight. especially if your weight is more than your ideal body weight. So weight loss, weight loss, weight loss and weight loss. That is the cardinal advice given on a general plane. Easy to say, difficult to do, but certainly that is something which makes a big difference. The second is something called positional therapy, that if you're sleeping on the back, on the belly, sleep apnea is much worse. There are a good deal of people whose sleep apnea is shown to be worse on the back, so sleeping on the side, and there are methods to do that, to maintain that, can be a major relief of sleep apnea in terms of a simple thing to do, and has a great deal of efficacy. In addition to that, we also recommend that you avoid things like alcohol and sleeping pills, because both of them are muscle relaxants which are known to worsen sleep apnea. So anything which relaxes muscles, such as these medications and addictions, are known to worsen sleep apnea. Once the general part is done, then comes the specific treatment. Specific treatment is we got to open the airway. To open the airway, in the past they used to bypass the airway by doing a hole in the neck called tracheostomy. That is done for very, very bad sleep apnea. In modern times it's hardly ever done. More common is other modalities. For mild apnea, we have things called an oral appliance, which basically tends to push the jaw slightly ahead at night. It's only one at night, and create space in the back of the throat so that it gets better. Surgical options also talk for mild, moderate and severe apnea. It's basically refashioning your airway and removing some particular large tissue components. However, they're done carefully under the supervision of the right people with the right surgeons, so as to try and make sure you have an impact, and it's not commonly done in our country. And the most common option followed in sleep medicine is to try and open the airway by pushing some air, and that's done by something called positive airway pressure therapy, PAP, or positive airway pressure. What is that? Understand that if this airway is shutting down, it's like a pipe which is collapsing. If we push some air into that, the whole pipe will open up and everything will get cured. Your sleep apnea, your snoring and all the symptoms which follow. How is that done in modern times? It's done by something called this CPAP entity, where we put a mask. The mask goes by tubing to a machine. The machine applies the pressure like a compressor machine. The pressure is transmitted to this entire airway and the whole airway opens up, and this is a cure for sleep apnea. Good part, it's wonderful. It's actually one of the best things shown in the last 3 decades since it came. The flip side of the whole thing is that you have to sleep with this mask and this machine, and that's why you need a proper medical process where somebody sees you, orients you, decides this is the right thing for you, a study is done, and then the right numbers and the right treatment is given to you to make the process easier. There are other out-of-the-box treatments and newer things which are there, but they're not that common, and they'll be discussed at when we have more time in the session. Right, so I think we went through at great length with CPAP, with how the process is, diagnosis, what is it all about. To give you a few more lines, this CPAP also has become more comfortable over the years. Obviously, none of us like the idea of sleeping with a mask on your face every night. People ask us every night. Yes, the answer is every night, unless you are in a position where you can't take the machine or there's a problem. Otherwise, every night. We like to have 6 hours per night. We have much more comfortable machines now. Just as you saw a Maruti 800 turning into a mid-sized car, turning into a Merc, we have machines and masks which have become much easier to wear and which are geared up towards the patient's comfort, your comfort and my comfort, more than actually just delivering pressure. So pressure delivery by a machine using a comfortable interface such as a comfortable mask with the right parameters supervised by the right doctor defines CPAP therapy, which is what is going on at this point. Yeah, so this is a major thing in the Western world and significant in our world, especially now. Why was it significant is because imagine, I'll give you a scenario. I am a truck driver. I drive an 18-wheeler. My average speed in the Western world is going to be 100 to 120 kilometers an hour on a highway. Now, if I take that 18-wheeler and I sleep at night, but I'm tired in the daytime, as the vehicle is going along, I may suddenly feel tired and doze off. I will try my best to fight it, but there's points at which with severe sleep apnea, people can't help it. And especially if they're sleep deprived, if there's any reason that they did not sleep enough at night and they have severe sleep apnea, it's been known to happen that they dozed off while driving a car or a vehicle. It's okay if you're driving a cycle, but if you're driving an 18-wheeler and you take that and that goes on the highway off-road, you're going to be basically not only harming yourself, but probably harming, endangering or killing a whole bunch of people. So that is why in certain states in America, you are obliged to inform the driving authorities, and the license may be on suspension if sleep apnea is not cured, so that safety to others and safety to yourself is taken care of. Shift the scene to India. We have highways now. We have highways where similar speeds are there. We have drivers who are sleep deprived anyway. And on top of that, if they have sleep apnea, then this can be a problem in our country. In fact, it's shown to be a problem in our country right now. Not only that, these drivers usually don't exercise, so they get heavier and heavier, they put on weight, sleep apnea gets worse, and it's possible one day that such an accident may ensue. Anybody who has any either near miss, that means they have felt asleep and felt they would hit somebody, or even as a fender bender or any accident, is supposed to be somebody who should be fast tracked for evaluation and treatment of sleep apnea or any other sleep disorder which may be interfering with their job. Right, so I think in this overlap we've gone through some of these things. We've talked of quality of life issues at length, where again, to reiterate, it's basically quality of life, which is a self measure and a family measure. Self measure is I'm tired, I don't have energy, I'm fatigued, I don't think I can do anything, my motivation is down, people at work complain I just don't do enough and I can't push myself, my career is going down, my people at home are not happy, I keep dozing everywhere, I'm also going through some sexual issues and it's a problem for me over there, I'm depressed. So these are all the consequences which come in terms of quality of life. So it can be divided into self, home, job, and overall psychiatric issues which can come up. In terms of health issues, as we discussed, the concerning parts are high blood pressure, heart issues, strokes, sudden death, and a significant overlap with disorders such as diabetes, rheumatological conditions, and many other such issues. Right, so cardiovascular is a blanket term. The main correlation has been shown with hypertension and sleep apnea, studied for more than 20 to 25 years, where sleep apnea of moderate to severe degree has a significantly higher chance of developing high blood pressure, and conversely, people with high blood pressure which is not controlled very well should be looked at from the sleep apnea point of view. But as long as they're not controlled and they are seen by a doctor who understands all these issues. It's not that every hypertensive needs to go through sleep apnea workup. Then comes beyond that, obstructive sleep apnea and cardiovascular risk. People with heart disease are known to die much more. So it's known to be a risk factor for people with pre-existing heart disease, and the chances of sudden death are much higher. It's known to worsen congestive heart failure. Sleep apnea is associated with these things called arrhythmias, where the heart tends to get less oxygen and have these rhythm issues which can also be life-threatening and also get you into hospitals. So these are all the repercussions. Cardiovascular also includes the brain, and there's a significant association between strokes and sleep apnea itself being a risk factor for stroke. So every part, right from wherever the heart and the blood vessels supply, right from the brain to the heart to even your vessels of the leg, all of them have associations with sleep apnea. The worse the sleep apnea, more is the association. So diabetes is supposed to be worsening. It can't be a causative factor. We can't get up and say that sleep apneics get diabetes. It's just that if there is diabetes, it can be a little difficult to control if there's uncontrolled sleep apnea. That is the relationship. People have tried to show more than that also. There are some reports and all that, but that's variable right now. More will come as we go by. But the association has been shown. So more and more we're trying to find common disorders which are existing in our population to say that we interact. But knowing that high blood pressure, heart disease and stroke itself has got such ramifications is concerning enough. Very difficult thing to do. Indeed talked about a lot. It's like docs and nutritionists talking, eat the right thing, live the right life, sleep the right way. The rules are very clear and you can just put it on your on the net and it will pop in front of you. We'll go over it very briefly. The idea is try as much as you can. Life is not completely about being militarily regimented in such areas, but it is that try your best in terms of prevention, and certainly if you have a sleep disorder, it's very, very important. First rule is get enough sleep. Average human body needs 6 to 8 hours of sleep. It is something which is now agreed on, so that is something you should get on a common basis. The second is it is said that you should try and sleep within a certain rhythm. So usually the sleep time should be 10, 11, 12 at the most, and it should be accordingly positioned and not shifted either too early or too late. In terms of things to do, it is advised that you do not take heavy meals before bedtime. It is advised that you avoid alcohol, sleeping pills, narcotics, which are common nowadays in the younger people especially, and smoking within a few hours of bedtime. Ideally one should never take it, but at least those who take it within a few hours of bedtime, it should not be taken. Also, we ask people to avoid stimulants such as tea, coffee and any such caffeinated drinks which can also be sleep disruptors. heavy meals before bedtime are supposed to be sleep disruptors. So there should be a healthy gap between your last meal, and the last meal should be a little light. To sleep better, it's recommended that you have nice exercise, 3 to 4 hours before bedtime, which helps you to promote sleep at night. It is also advisable not to be, in this modern era, not to be glued to your electronic devices immediately before sleep. So it's nice to have a decent gap, because electronic devices, whether they're smartphones, tablets, computers, or the television, have bright lights which are known to be sleep disruptors. So the rhythm of sleep is that you tone down, avoid stimulants, avoid bright lights, have the relaxation time, go into sleep in the proper environment, which should be dark and as much as possible reduced with noise and disturbances. Sustain sleep by such an environment. Have at least 6 to 8 hours of sleep, and that helps to wake up fresh in the morning, as long as you don't have disorders such as sleep apnea, insomnia, and so on. So these are a few common rules of sleep hygiene which each one of us is supposed to follow. As we said, good to do it preventively, but if you have a sleep disorder, it's very important that all these are reinforced. Well, World Sleep Day comes down to the fact that sleep has been around for donkey's years. Humans took it on them to understand its importance much later. For the last 60 to 70 years, we decided that this is sleep. We studied sleep more, came to know more about it. Then it took us so many years to realize that if it is 1/3 to 1/4 of your life, give it importance. You give importance to your health, you give importance to your job, you give importance to your education. All of this is based on the foundation of a healthy body. Sleep in the classical sense is a healing time. It is the rest time, the downtime. No vehicle runs 24 hours. Nothing runs 24 hours without backup. This is the human way of saying, I need to restore. I need to get all my 8 million processes into place, which is what happens. I need to respect that. I need to make sure this is okay. And that will allow me to function for the remaining 16 hours in a productive fashion, which will allow me to be a wholesome human being. So understand sleep. Go back and look at yourself. Respect it. Follow the basic stuff. Learn from what is there out there, and ultimately if you have a problem, seek help, because otherwise once it goes into the chronic stage, it takes that much more time to improve things. So everybody, sleep well, know more about this, sleep healthy, and for God's sake, wake up to know more about your sleep.